Hello dear student, in last class I have already told about different drug action and drug mechanism of action and different component in our body which are going to act or going to bind with drug and help it to reach its specific site of action and to show its desired therapeutic effect. And in that component I told you the most important component that is going to play the most of the important role for drug to show its action into a specific site and to show their mechanism of action to give desired therapeutic effect. So today in this class I am going to discuss in brief about receptors. So in this video what I am going to cover, that is receptor. In a receptor, that is a very vast syllabus. Last class I have told the types, and all the types I am going to explain one by one into the upcoming classes in small topic. Today we are going to discuss in small topic about receptor part. In that what we are going to discuss the definition of receptor, how it is going to show its action, and different important terms that are related to receptor drug binding action, how it going to act. There are different terms that you have to understand to better understand in next classes when I am going to explain different receptor, and in upcoming classes when I'm going to discuss about mechanism of action of specific drug and their classification. So to understand all the things, that terms you have to remember and you have to understand what are the terms and what are their definition, what are their action, why we are using that terms. So first is definition. In last class only I told you receptor is a physical and chemical macromolecular component or agent, that is present in our body in specific site which are going to bind with different physiological component like hormones, neurotransmitters, enzymes, etc. All that receptor also are going to bind with the drug. When we are going to administer drug from the outside, that drug is also going to bind with a receptor and it is going to show its action. How it is going to show its action? It will receive and then it will respond to the electrical signal response, and they will decide whether to bind with drug, and that receptor will think which is the specific receptor that should bind with that drug, that will help that drug in maximum quantity or maximum potentially, so that drug can reach into the specific site of action and it can show its 100% mechanism of action or their therapeutic desired action. So to understand their mechanism of action or receptor, how it is going to act or how it is going to work, we have to just remember a simple diagram. By that diagram you can easily understand how that receptor is going to work. First thing is specific site. What are the specific site? We know specific site means a particular site where only a specific part can sit. इसका मतलब क्या होता है? स्पेसिफिक साइट होता है एक नॉर्मल एरिया जिसमें कोई पार्टिकुलर बंदा ही बैठ सकता है. Just think it is an area or it is the specific binding site. Here what will happen? Different ligands are there, different physiological components are there, then receptor components are there. All that things, what will happen? That will sit into a specific site, that is specific site, and they are going to show its action. The specific site where it is present, in enzyme it is present, in a receptor also it is present. And you have to remember receptor is present inside and outside of cells, and depending upon where the receptor is present, outside or inside, their mechanism of action depend, and that also depend which type of drug is going to bind with a receptor. Just think it is a cell. Just think, if it, the receptor is present outside that cell, if that receptor is present outside of cell, then that drug or drug can easily come and bind with that receptor, or that ligand also can come and bind to the specific site or specific action site of receptor, and can bind and can form drug receptor complex. That drug receptor complex will reach to a specific site depending upon the specific receptor and going to show its action. So for that, drug should be, can be lipophilic also, hydrophilic also, because here that receptor is present outside the cell, so that drug don't have to cross the lipophilic membrane of the cell, so that drug can be lipophilic or hydrophilic. So both type of drug can easily bind to that receptor present outside the cell and can show its action. Now suppose it is the cell and that receptor is present inside the cell. That means if the receptor is present inside the cell, that means that drug to bind with receptor and to show its action inside the cell, that drug have to pass that membrane. That membrane is form of lipophilic or lipid. So we know, if that drug is cross that lipophilic membrane and to enter into the cell and to bind with receptor to form receptor by drug complex, then the drug should be lipophilic in nature. So by that we can easily understand, if that receptor is present outside the cell, then that drug don't have to cross that membrane. So that drug, if it is hydrophilic also, lipophilic also, it can easily bind with the receptor present outside the cell and can form drug receptor complex and show its action. But that if the receptor is formed or is present inside the cell, then drug have to pass that cell membrane, which is made of lipid. So to cross the lipid, that drug should be lipophilic in nature. So lipophilic drug only can pass through inside the cell and can bind with the interior receptor that is present inside the cell and can form receptor drug complex. That's how that receptor is going to act, and it is going to bind with specific drug, whether it is hydrophilic or lipophilic, and going to reach into a specific site of action and going to show its desired pharmacological or desired therapeutical effect. So now we have to discuss about different terms which are very important in to understand upcoming receptor classification and understanding different drugs, which we are going to discuss in specific part, how they are going to show their action all in all that theory. Different terms it will come again and again. So to understand better all that terms, I am going to explain what are the terms you have to remember. So the first term is agonist. So first thing is agonist. So what are the agonists? Agonists are the agent which is going to bind with that receptor, that is a specific molecule or specific agent that is going to bind with that receptor and going to show its action as the natural physiological molecules or components. Like one example I am telling, in any how or in any reason our body is not secreting histamine. So to secrete histamine or to fulfill that disorder, or to increase the release of histamine, we have to take a drug from outside as per the requirement of that condition. That drug we have to take. That drug, just suppose that is agonist, what it will do, it will increases the release of hydrogen or the release of histamine. That drug, what it will do, that drug will having same action, will have same action such like histamine. So we are going to take that specific drug that is going to that specific site which are having histamine receptor as the drug as that same physiological action or same physiological size or same physiological structure as the histamine, so that drug can easily act as histamine and the drug can easily bind to the receptor present for histamine binding like H1, H2, H3, H4, all histamine receptors are there as the drug has same physiological molecular action such as histamine. So histamine receptor will bind with the drug and drug can show its action as histamine show action in his body. So here example I have easily told you the histamine complement drug which are going to act same physiological action as natural physiological histamine and going to bind with histamine receptor H1, H2, H3, etc. So that is the example of and the theory or the term of agonist. Now with agonist, the another term we have to remember that is reverse agonist. First thing, just forgot the reverse. Just remember agonist. Agonist, what I told you, agonist that will activate drug activate that will activate receptor and going to show its specific action. Now just think about reverse. Reverse mean what is that? Reverse mean that is opposite. Reverse mean opposite. So what it will do, like agonist, reverse agonist also activate the receptor, but it will show opposite action. So just suppose that is one specific site. Just remember that one is agonist. That one is reversible agonist. If that agonist is going to bind with that receptor, then what type of action it is going to show? If that partial agonist is binding with that receptor, it is going to show opposite action. Just example, one drug you are taking, if that is agonist, if that is increasing that histamine level into our body, that means that is acting as agonist. And if that drug which are taking from outside is decreasing the release of histamine, that it is reversible agonist. But here one thing is same, agonist or reversible agonist, whatever it will bind to its receptor and then it is going to show its action. If it is agonist, then it is going to show exhibitory action. If it reverse agonist, then it will going show inhibitory action. So like that you have to remember what is agonist and what is reverse agonist. Now the third term is antagonist. What is antagonist? Antagonist is the opposite of agonist. Mean what it will do? It will bind with a receptor and it will inactivate the receptor so that the drug is going to show inhibitory action in specific site. So just example I am telling you, last agonist example I told you, your body is not secreting histamine, that's why you are taking one drug that is going to show as similar action what histamine is and going to bind with histamine receptor and going to show as same physiological action what are going to shown by receptor histamine, that same action that will be shown by that drug. Here just think that opposite. If your body is releasing more amount of histamine and you want to inhibit that release of histamine, then you are going to take a drug that has opposite action of histamine so that it can bind with histamine receptor and can reduce the release of histamine. So that is how antagonist is working and that is how antagonist is defined for. Now the last and final term is partial agonist. What is partial agonist? Just think, forgot about partial agonist. Just think about agonist. What agonist do? Agonist is a agent that is going to activate a receptor and binding with a specific site and going to show its action for a duration of time, and that action will be limited for a time. So that is tell us an agonist. Now think is partial agonist. Partial agonist means what? Half means that they are not going to show their action as high or as potentially or as efficiency as agonists are doing. We can easily understand by a simple drawing a simple diagram. Just think that is one receptor, its specific site is present here. Now it is a partial agonist, and that is full agonist, or that is or normal agonist or full agonist. If that full agonist is going to bind with receptor, it is going to show you one action. And if it is not binding, partial agonist is binding with a receptor, that is also going to show same action. But in case of full agonist, it is going to show action for a higher duration of time. But in case of partial agonist, it is going to show its action for a limited duration of time. So in case of full agonist, the duration of action is more, and for partial agonist, the time limited for the action of receptor is less. So that is how partial agonist is and partial agonist work for. So by that, I have in short explain about different terms, definition of receptor, how it is going to action, and what are the different terms that is related to mechanism of action of different drug and different receptor. In upcoming classes, I will be discussing about different types of receptor, as it is a vast chapter. So all that receptor types one by one I am going to explain into the small upcoming videos. Thank you for today.